Good afternoon, everyone, and welcome to our 8th webinar. Epoch Practice is doing a series of webinars that you can see on our website. This webinar is being recorded, so if you wish to don't appear, please turn off your camera. We will have a Q&A session in the end, but the chat is functioning, so if you would like to write your comments, write where you're from, your questions in the chat, you can do it. Otherwise, in the end, you will be able to raise your hand and ask directly your questions. I will stop here and passing the floor to our director, Frank.
Hi, everybody. Good afternoon. My name is Freek Plouin, and I'm the director of VIVE. And I've been asked to chair you through this webinar. We have 3 presentations and 5 speakers today. We'll start with Lars Benjaminsen, researcher at the Danish Center for Social Research, VIVE. Lars, I think I can say that you're one of the, if not the key researcher on homelessness in Denmark. I've been working on the issue for a few decades already, so expert and especially expert on data collection. Then we'll move on to France with a presentation from DIHAL, which is the Interministerial Delegation for homeless people or for housing and access to housing. And we'll have 2 speakers. They will do a duo act, Nicolas von Bonn and Pierre-Yves. And then we'll end with a presentation from Marissa Plouin and Alexandre Lloyd from the OECD. The topic of the webinar today is the link between data and policy, how to use data, how to make sure that data influence policy. And Lars, if you're ready, I am going to hand over to you. So the floor is yours. We were thinking about having interventions about 15 minutes, so that is sufficient time for questions afterwards and debate at the end. So Lars, the floor is yours.
Yes, thank you very much, Frank. I'll just share my slides. Yes, thank you very much. My name is Lars Benjaminsen, and I'm from the Danish Center for Social Science Research, VIVE, where, amongst other things, I'm responsible for conducting the Danish homelessness counts. And in my presentation, I will talk a bit about why we need a strong link between data collection and monitoring and policy development, and also give us a case example from Denmark, where we have worked on establishing this link for quite many years. But why do we need a strong link between data collection and policy monitoring? Well, first of all, because data and statistics gives very important information about trends and profiles of homelessness and developments that need to be taken into account in policy development. That is, of course, both whether we see overall increases or decreases in homelessness, but it's also local trends in cities, towns, regions, municipalities, where developments might go in different directions, and also needs to be reacted upon not only on national level but also locally. Data and statistics also give very important information on developments, trends in subgroups, for instance, homelessness amongst women, young people, families with children, ethnic minorities, whether we see changes in homelessness patterns in different groups that also needs to be reflected in policy developments. Then data and statistics also give very important information upon support needs, for instance, the prevalence of mental health problems, substance abuse problems, physical health problems, etc., and about the complexity of support needs, how many need more intensive support, and how many amongst homeless people have less extensive support needs and may, for instance, be homeless mainly due to, for instance, housing affordability problems. So data also gives indications about these underlying structural and systemic factors, challenges, deficiencies in welfare systems and housing policies that needs to be taken into account. So systematic data collection, very important for both monitoring existing policies and giving direction for policy development and the need for new interventions. But as we also all know, it can be very difficult to, it is difficult to measure homelessness. It requires an extensive data collection, but we see in these years significant progress being made across the EU. We see, for instance, in Belgium, many homelessness counts in many cities and towns. We see national new development in data collection on national level in Germany, where, for instance, we now get statistics also on hidden homelessness in the EU's largest countries. And we also now these years get valuable information from the EU Homelessness Counting Project that has been initiated by the European Commission on behalf of the European Parliament, and through which we will have now homelessness counts in many cities and towns across the EU where we did not previously have any data. But on the other hand, data collection is no guarantee for having a strong link to policy development and implementation. This has to be continuously established and maintained. And now I will give you an example of how we have been working on this in Denmark for quite many years. We had, back in 2007, the first national homelessness count in Denmark. Before that, we actually already had shelter statistics in place on the use of homeless shelters nationwide in Denmark, but we did not have information on other forms of homelessness, such as the extent of rough sleeping or hidden homelessness, people staying, for instance, with sofa surfers that stay with family and friends. So there was an ambition to get more comprehensive statistics, and at the same time, this first count was, so to say, also the offset for developing Denmark's first and actually only national homelessness strategy that was announced by the government just after the publishing of the results from the first count. The strategy period was set to be from 2009 to 13. And the results from the first count fed into the formation of this new strategy program. We did a second count in 2009, early in 2009, that then served as the baseline for this national homelessness strategy. 8 larger cities and towns in Denmark was selected for the strategy program, actually based on the results of the first count, and more municipalities were added during the period. This first program, the national strategy, has had one of its main focuses to develop and test the housing first approach in a Danish setting, as there were already at that time emerging evidence of the effectiveness of this approach. Since then, there has been many subsequent programs, follow-up programs to the first programs. We had a big implementation program that ran from 2014 to 16, further working on implementing housing first. We had a youth homelessness program that ran from 14 to 17, and another program called the Extension of Housing First from 2017 to 19, and latest we had here in 2023, just a few years ago, a quite extensive reform of homelessness policies, where there has been various policy changes aimed at transforming homelessness services towards housing first. And throughout this period, the results of the trends, developments in homelessness has been monitored by national counts with an interval of 2 years from 2011 and onwards until the last count we did in 2024. These counts both give national figures, but they also give figures on local level in municipalities so that policies can also be adapted and developed on local level. I will not go into detail with all the programs, but an example of this interplay. But I will talk a bit about the counts, what kind of data is it that we collect, and briefly also how we are doing it. As mentioned, we have done this every second year since 2007. It's a point in time. It's a week count that always takes place in week 6 every second year, which is conducted by my institute, the Danish Center for Social Science Research, on behalf of the Ministry of Social Affairs and Housing. It is what we call an extended service-based counts. It does not only encompass homelessness service, but also a wide range of other services, homeless shelters, street outreach teams, psychiatric treatment facilities, addiction treatment centers, municipal social centers, job centers, etc. This to capture a broad picture of homelessness, not only people in the homelessness services, shelters, etc., but also, for instance, people staying with family and friends due to homelessness, and to the extent that they are often in contact with many other parts of the welfare system. It's individual data, a 2-page questionnaire for each homeless person that are in contact with these services. The questionnaire can be filled out both either by staff or the homeless person. It's based on the use of unique identifiers and other information to control for double count. And as I mentioned, it's a nationwide data collection where we produce both national numbers but also local statistics for each municipalities. And we have profile data also on demography, health, income, use of other services, etc. As I mentioned, it does not only include people in homeless services, but also, for instance, rough sleepers, the first category here, and for instance, category 5, people staying temporarily and without a contract with family, friends, or acquaintances. Those we usually also refer to as couch surfers or sofa surfers. Now let's see, how has it been going with homelessness in Denmark throughout this period where we have had all these programs? Well, what we saw was actually that homelessness was moderately increasing throughout the years, from 2009 onwards to 2017, where it peaked at about 6,500 people. We were, of course, aware that can be a kind of counting effect involved when you do more and more counts and people get better and better at counting. But we could also see that trends were more specific. There were certain age group, for instance, young homeless people, where it was increasing more than in other age group. And we could also see different developments in different local authorities. So more what was at play than only a counting effect. Then finally, we began to see the figures dropping a little bit again, which was probably due to this extensive focus on trying to implement the housing first approach. This is difficult in practice. We are also in Denmark up against, for instance, increasingly difficult housing market, especially in our larger cities. So many factors play into this and can draw in different directions. But probably this decrease was an emerging effect of all these efforts. And then, unfortunately, in the last count, the number increased a little bit again. Again, this struggle between many factors that can play into the picture, so to say. And we don't know how would this graph have looked like if we had not had all these programs in place. We have also seen other countries that have had quite a strong increase in homelessness over this period. As I mentioned, we don't only get, we get figures on different homelessness situations widely modeled on the ethos light definition. As you can see here, one of the things we can see, the largest group are people in homeless shelters, and despite these efforts, that's the third row here, homeless shelter, and despite these efforts of trying to implement the housing first approach, we still have even an increasing tendency here, and we still have quite a significant proportion of homeless people in homeless shelters. We can also see that the second largest category is not the rough sleepers, but that is actually the fifth line here, people staying with families and friends, which for instance include relatively many young homeless people. So including these categories into the picture is also very important. We can see the count gives information on the geographical profiles, where, for instance, we can see that the big urban areas are overrepresented. The Copenhagen city is the red bar, and the blue bar is the Copenhagen suburban area. So we have like almost half of homelessness in Denmark concentrated in the Copenhagen area. But we can also see that we have homelessness in other cities and towns too, and also in medium-sized and smaller cities and towns. We do also have homelessness to some extent. So the count also makes visible that we have homelessness on different scale, but also in smaller municipalities that each get their local numbers each time we do the counts, and can see whether that sets off a need for further interventions also on local level. As I mentioned, the count also gives important information about support needs, where we can see that a high proportion of homeless people in Denmark have substantial support needs. About 65% have a mental illness, the same addiction problems, and more than 40% have a dual diagnosis with the mental illness and a substance abuse problem at the same time. Very typical for a country like Denmark with quite an extensive general welfare system, that homelessness is widely concentrated to people with complex support needs, which also means that when we develop interventions, we need to think this into account, and this widely calls for the specialized support services that are part of the Housing First package, the intensive support services like ACT and ICM, and not just a less extensive support. So important information also on the nature of support needs. One thing I want to highlight also, one thing that we learn from counts is the second largest group of people staying with family and friends due to homelessness. They also widely look like other groups. They are also people with quite complex support needs, so they widely need the same kinds of interventions as the other groups. Now, well, as I showed you, the overall trends has unfortunately been quite stable. We did not succeed in bringing homelessness significantly down, but here's a more specific example of how policy monitoring and policy development interacted. What we saw in the first year was quite a strong increase in youth homelessness. Due to many reasons, probably increasing numbers of young people being in the risk groups with mental illness, substance abuse problems, but also being affected by an increasingly tight housing market in larger cities, etc. And there was a strong focus that we really need to do something about this. One of the programs, as I showed you, was a youth homelessness programs that had as a specific focus of implementing housing first amongst young people. And this program was set in motion around 2014-15. And we could, after this, involve both initiatives of national level, and quite many of the bigger municipalities were involved in this. this project, and we could see in the coming years a turnaround, quite a significant drop in youth homelessness that was probably widely due to this very targeted intervention that was set in motion because we could see the numbers rising. Something was done about it, and we managed to get numbers down again. Then, unfortunately, now it's stabilizing and not going further down, as you can see, but quite a significant development. On the other hand, if we look at the other age groups, we can see there is much more stability in the pattern. This is also an indication that we might consider to have a much stronger targeted focus also on the, for instance, the middle-aged groups that are the biggest groups in homelessness. And we see, unfortunately, also an increasing trend amongst in the oldest age groups. The yellow line at the bottom are the plus 60 years old. So this also calls for more targeted interventions in this group, and that obviously also more could be done. So concluding remarks, data collection and monitoring, very important aspect of policy development and implementation. Continuous monitoring is crucial for assessing the effectiveness and also the shortcomings, the gap of policies. We need this dynamic interplay to enable reactions and initiatives responding to new trends in homelessness, as the example here, with the increase in youth homelessness demonstrated. But on the other side, monitoring and even policy programs for bringing down homelessness, as many factors on many levels play into this and affects the overall development in homelessness. But continuous monitoring gives us indication of both the impact of policies, but also the impact of other societal factors that play into the picture. Thank you.
Thanks a lot, Lars, and it's quite impressive what happens in Denmark. Sometimes the FIANSA will refer to Denmark as the Valhalla when it comes to data collection and homelessness. So there is lots possible in Denmark, might not be possible in other countries, but still useful to see it as an example. At the end, after we have the 3 presentations, there will be time for discussion, question and answer, but just a few questions, Lars, immediate questions that come to my mind. You say that you have national accounts every 2 years. Is that a good rhythm? Or if you could change it, would you go for a different rhythm? Is that the sort of rhythm you need to inform policy, to allow policy to have effect before you count again? The other quick thing that I would like to ask, have the data ever been contested? Are they still contested by sectors or part of the sector that you need to progress towards ending homelessness? Because I guess data collection is important, but you also need an agreement that what the data say is accurate. And the last question I had, maybe I'll leave that to the end. Let's keep it with these two questions, Lars.
Yeah. Thank you. First of all, the interval. This has been set very carefully as a balance because it is actually a quite comprehensive exercise also for all the local authorities and services that are involved. And we have assessed that doing it every 2nd year give sufficient energy for doing it. It's all voluntarily done by the whole sector and by local authorities, etc. So it's also important that there is a strong commitment and in participation in the count, which there is. And I think if we did that, for instance, every year, it would be too comprehensive. Having it every 2nd year is for us have shown to be a good interval, and where it's also time enough that changes begin to happen. over 2 years, things might change, something can happen, and then we capture these changes at a reasonable interval, but not overburdening local authorities. And the numbers, I mean, we are of course aware also that there may be, or there will always be, people that for some reason is not counted. If people go completely under the radar, there is always also some local services that for some reason or the other don't participate, but that is kind of a comparable uncertainty that is there for every count. So that kind of levels out when you look at the overall trend. We do hear, especially some actors say that we might especially have probably some underreporting in this category of people staying with families and friends. I think that is unavoidable. There will always be that. But on the other hand, what we do see is that also, even when we go down on local levels, there are some remarkable kind of consistencies in the patterns. For instance, differences between different cities, even cities that are comparable in size, may have different levels of homelessness that manifests throughout the years continuously. And that kind of shows that we capture the big picture. But of course, there will be some uncertainty when you count such a complex phenomenon as homelessness. But that is something I think you have to live with. First of all, for policy development and monitoring purposes, the data gives generally a strong foundation for looking at what direction are things going, and where do we need to do something.
Maybe very quickly to end, Lars, if you look at the last count, the 2024 count, is there any learning from that? Like, it's quite impressive to see you found an increase in youth homelessness. Specific program was mounted to address that. The numbers went down. Is there anything that you see in the 2024 counts that should alert policymakers and require some changes to the policy in place?
I think the main conclusion had been that the downward trend that we started to see from 2017 and on, and from continuing from 19 to 22, that has stopped, and now we return to like this more or less the same level than in the previous count. And it's also, I mean, the count is a statistic exercise. It is a data collection. It doesn't in itself say what are the underlying factors. But we are, as in many other countries, also aware that also in Denmark, we are up against an emerging or an increasing housing affordability problem. It has been there for a long time, but it's accelerating. We can see, especially where it's difficult to get the numbers down, is in the Copenhagen region, where we have half of homelessness in Denmark concentrated. So it's probably an indication that strong structural factors are at play. That, of course, also, and it's very important, also a thing that has been discussed. I mean, the Danish programs have widely been focused on implementing the housing first approach, but it's very important not to confuse these things. This is probably mainly a picture that strong structural factors are at play, rather than that makes it difficult to implement like a program like Housing First. So this is some of the discussions that it has offset.
Thanks, Lars. We'll keep it for the moment here. You stay with us, so there might be other questions and comments coming later. And thanks for generously sharing your insights. So now we move to our colleagues from DIHAL in France, Nicolas and Pierre-Yves. I don't know how you want to do it, but you must have shared the presentation between you, so the floor is yours.
Okay, can you hear us?
Yes, we can hear you, but the slides are not yet in full screen mode.
Is that better?
Yep, perfect.
Okay. So thank you for having us. We are Pierre-Yves Simon and Nicolas, and we work at the DIHAL, which is in French, Délégation Interministerial à l'hébergement et l'accès au logement, which is a body, government body that is responsible for implementing the state policy, public policy on emergency accommodation, access to housing, and housing retention for homeless or poorly host individual. And the goal is administration is to provide both strategic and operational guidance to in collaboration with other ministries, local authorities, and NGOs. And we deal with the Housing First policy, which is in France, started in 2017, and whose goal is to prioritize rapid placement of homeless and inadequately housed individuals into stable housing. To ensure their long-term social support and housing. And we also have to deal with the emergency shelters and support toward housing. So we've found the general shelter system to temporarily accommodate homeless people and guide them toward a more stable housing system. We deal with the budget, which is called the budget program 177. Accommodation, pathway to housing, and integration of vulnerable people, that is voted at the end of the year and is around 3 billion euros per year. So we are not alone in this task. So the budget is voted by the parliament and the government. And then we have a fixed budget, and we have to, in the DIHAL, we have to read the national state policy and how we distribute the money between the different tasks that we have to do, and the geographic of it in the decentralized state service. But most of the work is actually done by association, especially SEAO, that records the demand of homeless people into accessing shelter, and guide them toward accommodation or shelters. So this is very important because the data is collected at very different level and is used at different level also. For example, SEAO collects data and then produce statistics that they use to advocate and to discuss with the state to talk about the needs that their territory have. And we also measure things at the DI level, but it's computed and compared and measured at very different levels. So there is many ways to measure homelessness. So in France, we mostly use these 3 categories. That is the street counts, which is just estimates the number of people sleeping rough at a point in time. And in France, we have the Night of Solidarity, which is a night each year happening in many cities, but mostly cities. And people go in the street and count people. So it's have bias that exclude people in temporary housing, and it only reflects the people that are very visible in the streets, but not the people that are hiding and stuff like that. Also, we have population census and household surveys, which is just counting people and survey them at a point in time also, which is mostly done by insane dress. So it's very important for having precise insights on people and how they live, how they like to ask them very precise questions and get very important insights for the long-term construction of public policies. But it's very resource intensive, and we don't do that frequently. Also, we have more service-based method and administrative data. So in France, SEAO and social workers all used software that is called SEAO, and they record information about people and the process they endure to access housing and accommodation. So we can use this data to get insight on the needs of people, and how long it takes them to access housing and accommodation. Obviously, it has this big selection bias because we only count people that want to access it and people that access to it. And it's not the case. It's not well. It's very different depending on the territory and department. but it also gives us a lot of data that we can deal that gives insights on a very large scale compared to other methods. And then after measuring things, we can use this data for mainly two tasks. The main that we can differentiate, the main one is policy evaluation, which like more long term, which asks the question, did the intervention that we propose in the public policy had the intended effects? And we measure things by doing some science, counterfactual analysis, experimental stuff. And we produce paper, not us at the DIHAL, but like academia and researcher, produce information about that and guide the public policy and what is working the best. And also we can use the data for operational steering, which is what operational adjustments are required now to match needs and offer the best way that we can. Which is more short term. We deal with continuous stream of data and like measure things by metrics and creating dashboard and other data visualization to give us insight on how much shelter we need to accommodate everybody and how lack of shelter is currently in this territory. As an example of policy evaluation, in France, we did important one, which is called Un chez soi d'abord, which is a form of housing first, but only for people with severe mental health issue and addiction. This experimentation started in 2011 and to 2016 on 4 sites in France. And it was very important policy evaluation because it gave us a lot of insights on how the housing first policy could work and like guides the implementation of housing first in France. So it dealt with a randomized study on 703 participants, and half of them get direct access to housing and intensive care, medical support and social support, while the other groups follow the traditional pathways. And it gave us a lot of insights. For example, that there is no predictive criteria for housing capacity, which is very important because it like says that we can't predict if this person or this person can access to housing, and that, therefore that we should give the same chance to everybody. Also, there is like mental illness, if well accompanied, is not a negative factor to remaining in the house. So this like insights gave us very important idea on like how we create policy and how we can give it to people. And for the operational steering, is like very different. We have a continuous flow of data, and there is many steps between understanding people's situation and getting actionable metrics and statistics. So we did a small graph here that like shows every step between like measuring and creating statistics. And we have a lot of way to doing it wrong, to have different stuff between like social workers that works differently, the software that doesn't work or work in a way that is not really well designed to be understood by people. Also, we can have like transnational and data warehouse issue, like data engineering stuff. The surveys can be misunderstood by people, and the data set then like common statistic issue. So at DIHAL, we're working on trying to coordinate and make all this works. It really works and very hard to do. So people, especially because we want to automate data collection and to get national insights on data to advocate for our budget.
So even when we have the data, after all that Nicolas has said, we need to think about how we communicate with that data to the political level in order to do the policy. Because our indicators are always abstraction. There is some proxy between reality and the indicator. And so they have some bias, like Nicolas said, and like Lars could have explained too. And so we need to have them in mind when you communicate about it. And also, there is a systemic problem about metrics that become the target, because the actors that may make some decisions about it, they may change the way of acting based on the measurement. And so when a metric becomes the target, it can be a problem to what you are supposed to measure. So we need also to have a very clear and readable way to communicate, because the decision makers have lots of things to decide, and sometimes our topics are not on the top priority. So we need to choose very carefully every font, every color icon we need to put on the dashboard and something like that, because all the decision makers may be influenced by that. So I can give you an example of a monthly dashboard and report which are addressed to the local prefects in a departmental level. So as Nicolas has explained, there is different level, and as a national administration, we collect all the levels of data, and then we are trying to report in the local levels to help them to guide the policy on the local level and guide the budget and drive the budget on that topic. So his is about the operational steering, like Nicolas said, and there is the shelter capacity monitoring data flow. And there is a little scheme about how does it work, but there is data from the monthly reports. We can use them in different Excel charts and plots, and then export them to produce a finished product. So here is some explanation and example. Like it's for the region Occitanie. And the topic is to figure easily the limits of budgets and the places that are planned to use, and the real measurements of what capacity shelters is produced in every month. And so you can see the tendencies and what the local prefect have to decide to enter the trajectory which is planned, and also maybe change the planification to help them and responding to their needs. And there is also the monthly report about the demand, because this one was for the supply and the capacity of shelters, and this one is about the demand and all the unresponded demand we have in the territory. And you can see we have some figures, specific figures about specific people, and like women, children, and people with difficulties about hospitalization or mobility. So this is supposed to help the prefects to guide the decision of opening or not opening different shelters. So yeah. But we know that all this problem between supply and demand and operating steering is a difficult way and not the best way to draw the policy. So as Nicolas said, there is a housing first program in France, which was taken in 2017, and it proposed to have immediate housing and try, and in the way to get out of the demand and supply issue. And so this plan is like in 5 years, a 5-year plan, which allow a long-term imagination and long-term solution, and monitored with 5 main indicators, which are chosen by the national level. And also these indicators are considered as top priority for the government. So the local prefects are also evaluate on the success of these indicators. So it's really important for us to have this monitoring with 5 main indicators, and so the prefects know that it is important for them to success in these indicators. So there is an example of the national level of we can show to the prefects to show them if the region is good or not good inside the targets. And this is about attribution of social housing to the people which are homelessness people. And this one is on a regional level to show them the creation of specific housing, social housing dispositions, which are like, je sais plus comment on dit. Intermediation. Social intermediation. And these are some different indicators of the Housing First plan. So we can say that we have some limits about it, because even if we have these well-defined indicators and targets to the prefects and on the national level, we can also understand that there is intertwined policies, because housing and social protection are also depending on migration policies or the global poverty fight of the government. So we have also measurement limits, because as Lars said, homeless people are hard to reach, and so the policy categories may not reflect the real situations, and there is a lot of things we cannot really measure. But this is the way we need to explain also the data using, by explaining how it is difficult to have a big picture on it. And thank you for your attention, and we are open to respond all your questions if needed.
Thanks a lot. Thanks for all of that. Very insightful. I wanted actually to ask the question that you already addressed at the end without answering it in great detail, but it's difficult. It's the data you get from the operational monitoring probably comes with totally different conclusions than the conclusions you get from the data that do the policy evaluation. And it might be difficult to sort of come with a coherent narrative if you try to combine both data sets. But I guess that your answer will be, yes, that's indeed incredibly complicated for us, but we're not sure how to deal with that. But maybe you have another reflection to share on that.
Yes, there is actually a big, recently a big work about putting coherence in different way the data are reported and in the different territories. And so, yes, it is very difficult for us to have a coherent picture of all the issues and all the measurements. But like Nicolas has explained in the first, the automation of the process and informatic tools can really help us to have a precise measurements, and maybe if it's not on all the indicators, it can give us a more frequent and more focused thing about the shelter capacity or the demands on different people. So yeah, it's difficult, but we try to work in that and to make it better.
Can I ask? I don't know if it's a question that is allowed, but do you have an idea of what is the cost of this data collection system that you have in place? So data collection / research.
So I don't know actually.
Yeah, we don't really have an evaluation of the cost of the, for example, the time of every social worker which has to use the tool, but maybe there is a cost, and there is also some benefits, because by using a universal tool, you can also gain some time on different other things, and us by using some standardization, and the data collection may be difficult for the social workers, but us, if we have current figures, it's easier for us to make some decisions and have a good representation. But yeah, clearly there is a lot of time, a lot of energy to put a coherence in it and have lots of exchanges with all the levels we presented you, because everyone at each level had some targets, objectives, and different things to measure, and yeah, it's complicated.
Yes,
I guess
also
the fact that you
sorry.
No,
We're also working on like improving the software, so it's like cost a bit, but it's very important for us to make it more simple and accessible to people, and so that the measure is better and better in quality. So it all increase, and we measure data quality to see like to have greater insight on the precision we can have on our measure.
Yes, yes. I guess the fact that the question on cost is not like there's no answer is probably a positive sign. It means that there is a consensus that sufficient effort and sufficient means have to go to data collection, because it underpins policy and management of the system. Thanks a lot. We'll probably come back to you later on, so stay online. But thanks for the presentation so far. So now we move to the last presentation from the OECD. Another duo, Marissa and Alexandre, will speak to us. We all know that one of the strengths of international or European data is comparison, transnational comparison. It might actually be used to progress policy and services for homeless people, but it has to be done in the right way, and it's extremely difficult. And Alexandre and Marissa know all about that. I'll give the floor to you. Your PowerPoint is visible, but not in the full screen. Yeah, now in the full screen. So, floor is yours.
Great. Thank you, Freek. I'll start off just by thanking Fianza for organizing this event. This webinar, it's been very interesting to hear the different speakers, and I'm very much looking forward to hopefully a conversation that we can have afterwards. I'll also just take a second to thank the European Commission and DG Employment for supporting our work. Our work contributes to the European platform on combating homelessness, and so we're very thankful for all the support we received. I will start with a bit of discussion on data and measurement. We're of course aware that there was a separate webinar on inclusive data collection, but I will start, I think, as a good starting point for the later discussions, and then Marissa will talk a little bit more about the link to policy and our work on monitoring policy progress. So if we start with the three main outputs that the OECD has developed, we started this process with a mapping exercise to get a better sense of the data that exists in OECD and EU countries. And as part of our work on measurement, we developed 40 OECD and EU country notes on homelessness data. And so this data, or sorry, these country notes include latest statistical definitions, the latest statistics disaggregated where possible according to ethos-like typologies, and a discussion of data collection approaches. After this process, we worked on the monitoring framework, which aims to help governments improve the measurement of homelessness. And so this was our second output related to measurement and data. And the monitoring framework includes a typology of different data collection methods on homelessness, their strengths and weaknesses, and how they can be used. And then it also includes a discussion of some of the groups that may be missed or undercounted. And so we heard a little bit about this in the previous presentations. And also a self-assessment tool to help decision makers improve data collection on homelessness. And so I'll touch on this a little bit more in detail. Outputs in tandem, so in parallel. And so they've really fed into each other in different ways. For the policy side, of course, considering the data is crucial to making sure we can have evidence-based decisions. But also on the data side, I think it's crucial to think about, when we're thinking about data, what the impact on policy can be, and always keeping that in mind. And so you can access our work on homelessness using the QR code, and you can also access the latest cross-national homelessness statistics in the Affordable Housing Database. Here you can see really, in many ways, the fruits of our labor of data on homelessness and trying to make data as comparable as possible. And so this data comes from the country notes on homelessness. And so what you see is the share of people experiencing homelessness per 10,000 people in 2023 or the latest year. And what we did as much as possible to make the data comparable is we first tried to standardize definitions. And so you will only see in this figure people living rough, so ethos light 1, and so that's in the darker bottom colors, and people staying in temporary or emergency accommodation. And so this is the lighter colors that you see on the figures. And so these are the only living situations that are included in this figure to make it comparable. And we also separated the data by point in time and flow data. So point in time data refers to data collected at a single point in time, such as a street count. And the flow data is data collected, for example, over a year. So maybe the number of shelter users over a year. Of course, though, we're aware that this data still has limitations, and so this is important to highlight. We know, as was mentioned in the previous speeches, that there are very different experiences of homelessness, and so this is likely not fully showed by looking at the number of people experiencing homelessness. There continues to be methodological differences, such as the types of shelters that are included in homelessness statistics. We know that in around half of OECD countries, shelters for victims or survivors of domestic violence are included, and the other half, they're not. And we know that specific subgroups are also likely to be excluded or missed or undercounted in homelessness statistics. If we now move, we can see the self-assessment tool that I hinted at earlier on. And so this was a big objective of the monitoring framework to help decision makers improve monitoring of homelessness and the measurement of homelessness. And so you will see the various different themes that we looked at as part of the self-assessment tool. And it was really designed in a way to help decision makers really pick and choose what they want to integrate based on the current state of data collection in the countries. So we're aware that there's very different levels of where different countries are on collecting data on homelessness. And so I will just briefly focus on the block on hidden homelessness and assessing hidden homelessness and then counting hard to reach groups. So here we outline 5 different things that can be considered when looking to improve measurement of hidden homelessness. So the first would be modifying different approaches to better account for the specific characteristics of the subgroups. And so, and I noticed this was mentioned in the chat already, but the London's census of rough sleeping for women is a good example of modifying traditional rough sleeping counts to better account for the specific experiences of a subgroup. Another option is casting a wider net, so looking at as much, or rather diverse, different low barrier services to better account for the fact that people experiencing hidden homelessness are less likely to use formal supports for people experiencing homelessness. And so having a wider net is more likely to have them show up in the data. Multiple approaches can better account for the weaknesses of different approaches. And so one example of this is in Canada, where there's 6 different data collection approaches to help sort of account for the weaknesses and bridge the gap between them. More frequent data collection can also be useful, especially in places where there's high temperature variation. And so trying to account for example, differences in the way homelessness is experienced in the summer or during a winter. And lastly, linking administrative data across sectors can be useful to account for the fact that different sectors will pick up on different aspects of homelessness. So with that said, I'll now pass off to Marissa to discuss a little bit more on the policy side.
Great, thank you, Alexandre. Yes, so as Alex mentioned, in parallel to the work that we were doing on kind of really focusing on homelessness measurement, there was also quite a bit of effort to look at, how we can improve public policies. What can governments do? And this was really, I think, a product of that really benefited from inputs from FEANSA, from NGOs, inputs from member states as part of this European platform on combating homelessness, as well as our delegates from the OECD Social Policy Working Party. So where we ended up here is with these 9 building blocks, and we've kind of grouped them into 3 strands. First, in terms of policy design, thinking about strategies, thinking about measurement and data, and monitoring and evaluation. And of course, 2 and 3 are key ones for this webinar. But really also thinking about how the blocks 2 and 3 are linked to, have a relationship with all of these other blocks. And so that was I mentioned the ones on policy design, policy emphasis. So thinking about, where in terms of public policy should governments potentially be putting more of their efforts? So thinking about transitioning away from a reliance on emergency shelter, temporary solutions for accommodation, towards more long-term housing first, housing-led solutions, more emphasis, more prioritization of prevention, and of course, the provision of low barrier tailored services. We saw also, this was kind of in the chat, it's not just about providing housing, because and also as our colleague from Denmark noted, in some countries, a lot of people experiencing homelessness have other needs besides housing. They have more complex needs, and so ensuring that these needs can also be met. And then finally, the third strand was looking at areas of kind of implementation and delivery. So these sort of fundamentals in terms of funding, in terms of kind of governance dimension of leadership coordination and capacity, including and specifically the capacity of workers and NGOs, of people on the front lines who are burnt out, paid poorly, have terrible, poor working conditions. If we want to transform kind of how governments are delivering homeless policies, well, these are the people and these are the institutions that are delivering it. So making sure that the capacity is there. And finally, the 9th block on the political economy of reform. So I think just to keep these blocks in mind as we go forward in the next few minutes, as we're thinking about kind of the data and the measurement and the indicators to monitor policy progress. I just want to highlight very briefly, you have the toolkit highlights available in multiple languages, and as of this morning, we have German online finally. So please feel free to consult those as well. The next slide. And I think I'm going to now get into kind of, we presented with Alex where we've been in terms of the work that we've been doing, and now it's going more into the direction of where are we going, what's next. As we know, as you all know, as we've already heard today from our colleagues from France and from Denmark, we know the existing data is presenting an incomplete picture. We know they don't tell the full story. While we certainly think that we can continue to do a better job of monitoring the overall numbers of people experiencing homelessness, of understanding who they are, what their needs are, why did they end up here, what are the structural, the different drivers that led people into homelessness, we absolutely need to continue to improve our knowledge about that. But we also need to improve our knowledge about other things. And I think this is really, I want to also thank Freek and thank FEANSA for pushing work in this direction. Because I think one question that they get, one question that we've also gotten is, you're saying that, when governments are putting the right policies in place, when they're doing housing first, when they're doing more in prevention, but we're still seeing numbers go up in terms of the number of people experiencing homelessness. So what other things can governments monitor in order to better tell the story, in order to better see how are we doing? And I think the examples that we saw from France are really interesting, looking at shelter capacity, looking at the housing first kind of supply or potential supply. And these are things that I think are definitely on our radar as we move forward. As it was also mentioned, this is a complex cross-sectoral challenge. It's a housing problem, but it's not only a housing problem. And so we need to also be constantly thinking about what are the links between different policy areas, and how can we improve the coordination and improve the policies across these different areas so that they're working together and towards common objectives rather than kind of in parallel strands. And the final point, I think, as it's sort of is in our mind as we're going forward, is yes, there's been absolute progress in terms of the knowledge base, but we know there's still gaps in the evidence. We know there's still things we don't know. We know that the numbers we see in terms of the overall number of people experiencing homelessness, we know they're not counting everyone. We know groups are missed. And at the same time, we also know in terms of homelessness policies, there's a good, as I think we know on this call, there's a pretty darn good evidence base on the effectiveness of housing first, housing-led approaches. There's less evidence on some of the other policies that we think work, and we need more research and more evidence on these. So this is kind of where we're starting in terms of the next phase of work that we're going to be doing. And I want to preface this point. Yes, go ahead. Preface this point. This is highly preliminary. You can see it underlined at the top of the screen. These are not at all the final indicators that we're going to be using or telling governments these are a good idea to use. This is the initial, we're in the very early stages of this work. And again, I think we have a lot to learn from the experiences of Denmark, of France, of other countries. But as we think about, as I said, these policy indicators, and to really make this link between data and policy making, what can we think about? What could governments monitor? What should they monitor? And so what we're doing now, and what we'll be doing over the next couple of years, is mapping a bit what policy indicators are potentially could be potentially used by governments. Which ones, so first we'll be doing a bit of a mapping to see what data are available. Not to say necessarily that governments are actively using them in homelessness policies and in monitoring the progress on homelessness policies, but what data could be, what data are available. And so we have a few examples here, as I said, drawing from the policy toolkit building blocks. This is just a few examples from a few blocks, but we're thinking obviously beyond these. So thinking about prevention, usually there are data available on the share of households who are in rental or mortgage arrears. What about also the availability of data on the rehousing rate among institutional care leavers or people who have been victims and survivors of intimate partner violence? So we know in many cases, these are potential pathways into homelessness. So could we be looking at things like that? We had some great examples from the DIHAL from France of specific housing-related indicators that they're already tracking, which I think is really interesting for us to have a closer look at. And then also in terms of low barrier tailored services, there's lots of things we can think about in terms of both individual health outcomes among people experiencing homelessness, but also access to healthcare, access to whether it's kind of mainstream health services or more low barrier mobile services, street medicine, outpatient clinics. These are the kinds of things that we're thinking about. And as I said, we're still at a very early stage in this process. Maybe we'll go to the last slide. I think we have, yeah, we can just go through all. So just to say that this work that we're doing now is fitting into kind of a broader package. This is the first piece that you see on the far left, a framework to monitor and evaluate policy progress. And maybe just to anticipate a question you might have or that Freek might have, is that we're not at this stage over the next 2 years collecting all of this data from countries. What we're doing now is a mapping to say what indicators are potentially possible, what indicators could be relevant, and a later stage, a later project could be looking at actually collecting that data, but that's not what we're doing over the next 2 years or so. And that this work on indicators will be supported by other linked policy work, looking more at integrated action plans that go across different policy areas. And then, as it has been well, I think, mentioned by our colleagues who spoke already, is really understanding better the drivers of homelessness in different country contexts. There's good research out there. There's not research, for all OECD countries or all EU countries, and these are things we're trying to see, to what extent we have research here. And also understanding a bit more in terms of the policies, what's effective, what works in terms of homelessness and housing exclusion. We have good evidence on housing first, and we need to see what else is out there for other areas. I think we will stop there and leave it, turn it back to you, Freek, and looking forward to the conversation with colleagues.
Yes, thank you, Marissa and Alexandre. Fascinating work ahead, not easy, I think, but happy to help you going through that endeavor. Maybe two quick questions, and because you said you will need time to get that monitoring framework operational. But I guess the idea in the longer run is to have some kind of a report that actually monitors policy progress in a comparative European framework for the countries that have sufficient data available. I think it would be so useful and complementary to the data that you already collect on the number of homeless people at point in time and flow data. So just to see if that is still the objective in the longer run, because I appreciate, of course, that you need time to get there. And the other question is more like, maybe I shouldn't ask, it's curiosity from my side. In FEANZA, we have been doubting long time whether we should rank countries on the basis of the number of homeless people they have. And you did it, and you showed it in the second or third slide. Did you get many reactions after you did that? Because some of that got picked up by the press. Because I guess people that are not informed about the background, they will say the countries that perform worst have the worst policies in place, and the countries that have least homeless people have the best policies in place. But that would mean that France and Germany would be really the worst, and Mexico and Greece, if I remember well from the slides, would be having great policy. Like, I just wonder, like, if there was a lot of reaction and how do you dealt with that, and if you would do it differently in the future.
Yeah. Thanks, Freek. As always, very, very good questions. I think the first one is maybe the easier one to answer, is I think, yes, we would like to head in that direction, but we are definitely not going to be there in 2 years. I think we're setting in place, hopefully, the foundations for that kind of, to enable that kind of analysis, but we won't be there in 2 years. The second question, yes, it's long been a challenge. The OECD, we like to be able to, we don't say rank, we're not ranking countries, but we do like to show, comparative outcomes. We, for many years, did not show it in homelessness because we knew how difficult it was to compare. We knew the limitations of the data, and we still know that even what we showed has a lot of limitations. Did we, I think there are a couple of ways to answer your question. First, did we receive feedback? Yes, we did. We certainly did. And I think, as you probably know better than many, this is also a challenge in terms of social media, in terms of, you have a figure and you don't have all of the background that goes into it to say, well, you need to also understand X, Y, Z. And I mean, the number of footnotes that come with this table are 3 pages long. So that's a challenge. And I think, at least to be very honest, I think we might rethink how we approach that in the future. Social media can be useful. It can also be a challenge, I think, in terms of making sure you're getting the nuanced message across. I think another thing maybe we learned from that process is how important it was to make sure we have the disaggregation between people sleeping rough and people in emergency accommodation. I think in the UK, for instance, or in England, where those numbers are so high, you can also look at it another way and say, well, they have actually done quite a decent job of reducing the number of rough sleepers. And what you see is transitioning people into temporary accommodation has been fairly successful. Is that permanent long-term housing? No, it's not. But, that is maybe a measure of another kind of progress. So I think there's ways to interpret that. And I think you bring up the good point of saying, well, you could interpret from this, that France and Germany are the worst. Well, no, we know that the policies in France and Germany are not the worst. In fact, they're doing really good things on a lot of fronts. And I think that's also a really good rationale and motivation for the work that we're trying to do now, is to say this isn't the only thing we should be looking at, because I mean, it was mentioned by France, it was mentioned by Denmark, is that there's a lot of more structural drivers of homelessness that are happening. Policy can try to make a dent, but it's not going, there's a massive housing crisis and all that. And yes, we can keep making efforts, but it's not going to be solved, in a year's time or in 2 years' time. So I think these are the kinds of things we want to be tracking. But no, very good questions. So thank you for that.
Maybe a very quick follow-up question, and then I hand over to my colleague to lead us through the question and answer session and debate, and there will be space for criticism as well if you want. But since it will take a little bit of time to get where we want to get in the end, is it thinkable to have some kind of a European comparative monitoring framework on the basis of the toolkit with the 9 building blocks, where you think of indicators, but more in terms of, has the policy included that, rather than has the policy that included that had the desired effect of increasing the outflow out of the homeless system, but say, well, is there a strategy in place? Does the strategy have a housing-led component? Is there a strong prevention element? Could that be something easy to do, which already shifts the focus a little bit or rebalances the sort of focus on homeless data, numbers of homeless people, and policy progress, without having a judgment about the impact of the policy, but we already know that the policy is going into the right direction?
No, that's okay. It's not easy to do. You said easy. It's not easy. I think it's definitely something that we can look at, and especially, I mean, one of the building blocks, as you know, is on strategy. So we could potentially look at, within that, what are some elements that could be important or that we think could be meaningful. So I think that's definitely something we could look at.
Perfect.
Thanks.
I'll hand over. Thanks a lot for all 3 presenters, all 5 presenters in the 3 presentations. I'll hand over to Sylvia again for the question and answer session.
Thank you so much. It was a really, really interesting session. And the chat, we are really happy to see that the chat was really, really active. I know my colleagues and also the speakers have tried to already answer to as most questions as possible. Also, we don't have a lot of time left. Just to refer that there were some questions around inclusive data collection, how to reach the more hidden homelessness, etc. As my colleagues drop in the chat, we did a webinar on that. So that is not about the Denmark or French example, but there's the Belgium and the UK example there. So I suggest that we skip those questions and you can refer to that webinar. Also, we will not answer all the questions, but you can either email them to us or to our speakers. And if you email them to us, we will make sure to get them answered through our speakers. And also I saw that there were questions about the presentation. So as my colleagues send in the chat, you can email us at epoch.practice@feanza.org so we can forward you the presentations. So I wrote down 2 questions for now. I don't know, as this is a meeting, people can also raise their hands and ask the question directly to our speakers. But for starting, I would suggest if Caterina Cortese, would you like to ask your question directly, or I can also just read it?
Yes, thank you. Good afternoon. Yes, my question is how we can harmonize the data collection for statistic purpose, for example, the point in time. And in the point in time, usually we collect data about homelessness in the categories 1 through 3 of ethos, and the broader universe of beneficiaries of the policies, because usually, for example, in Italy, the national plan, we have also other beneficiaries homeless people, yes, of course, but also vulnerable people, migrants, women, victims of violence, and people with the material deprivation, and so on. The question is, do you think it is possible to harmonize, or is a different scope, different aims, and different information we have?
Who wants to start? Lars, would you? Yeah, go ahead.
This is a big question. Thank you, Katarina, for asking it. I mean, I think one of the experiences we have had in Denmark when we have developed our approach was this thing about that in order to cover not only categories 1, 2, 3, but also the other categories, you have to include many different parts of the welfare system, a much wider range of services, and you also need to have agencies and services that are willing to participate and do this effort. We have quite a long tradition generally for data collection on various things in the Danish welfare system. So I think we built also upon that. And I've often been asked, can we generalize this approach to other countries? And my question would be, answer would be a bit cautious. Perhaps not. I mean, it's there are different contexts in each country. How many broader this kind of extended counting depends also on natures of the welfare system. You may have a continuum of countries, perhaps many countries with comprehensive welfare systems, but perhaps also different traditions of collecting data. And you also have in the EU still countries with less developed welfare systems, perhaps in a comparative scale where it can be more difficult to get these wider agencies to participate if you want something more than only a shelter count, so to say. So I think this transferability issue in can we make this fully comparable data collection, is harmonized data collection, is difficult. That is also touches upon the nature, the structure of service provisions. And so I think on the other hand that the new EU counting project has done tremendous progress, is doing tremendous progress on this, as there has been an ambition also in new cities and towns across the EU to try to extend the count in some cases to not only include just collecting categories 1, 2, 3 can also be an effort in some places, but there has been a lot of progress is made to extend at least across more countries and more cities. So I think progress is being made, but there are many parameters here to take into account.
Anyone else want to comment on this?
Yes, maybe on the French side, in our point of view, a way to have a different measurement is to measure the shelter capacity, as we said. So, and this could be useful for many different populations, including homeless people, women, victims of violence, and different things. So maybe it's a way to think about it by the supply and not by the demand.
Thank you. And another question, it's from Shadia Khan. I don't know if you're here and you want to ask it directly.
Sure. Are you hearing me?
Yes.
Is it? I had two questions, but is it about the longitudinal studies? Is it that one?
Yes.
All right. So I was wondering, thank you all for the presentations. They were really insightful. So I was wondering if there were longitudinal data or studies that evaluate the long-term effectiveness of homelessness programs. So I mean, not only housing first models, but also the prevention strategies. And the follow-up was, how are then such findings being translated also into policy or advocacy Thank you very much.
Thank you. Who wants to answer?
Yes, maybe on the French lines again. At the DIHAL, we have also we're conducting also the public policy about preventing the expulsions of the accommodations, and so in the case of some peoples or households which are suspended or may cannot pay for the rent and they could be expelled of their house, there is a whole thing to support those households and help them not to be help them to prevent the expulsion. And so we have some data sets about it we can use as to monitor the pressure factors on the shelter capacity after all. So we have some long-term evaluation about that because this is a policy which has been conducted for many years, but yeah, just a different way to approach the problem. Maybe it could be useful to, I don't know if other people in OECD also have this kind of programs or policies about preventing expulsion of the homes.
Thanks. We can maybe just add a couple points. In terms of homelessness prevention programs in place, yes, that is something I think we're seeing increasingly in OECD and EU countries. In terms of studies of the long-term impacts, I think we're not, at least we're looking into this, and we're going to be doing it as part of this next project. We don't have that yet, and we'll, I mean, come back to me in 2 years, and let's see if we have a better answer for you. But certainly, I think we can say that there's increasing emphasis on this type of policy, these types of programs, and seeing some kind of evidence of impacts. But I don't know if we have the longitudinal long-term impacts so far. But I also welcome others to contradict me on that one.
He is ready to meeting you in 2 years. Lars, would you like to add something?
But I think that's with the longitudinal studies is a challenge in most countries, and especially also studies that, I mean, one thing too is to follow policy and by these various point in time counts, but it's more also on the individual level. The longitudinal dimension is important to study. I think there are many programs that suffer a bit of the monitoring, that we study people for a relatively short while the program is going on, but what about later relapses into homelessness? So this longitudinal aspect has also different dimensions, whether we are talking on individual level or we are talking on more societal level, and also in general the more specific measurement of both the inflow and the outflow to homelessness is also a dimension that are under researched in most countries. The outflow, do we get the solutions for people? Are people actually rehoused? To what extent? What solutions do they get? There are many further aspects that we could have even more and better data on that could be helpful.
Thank you so much. I will close it here because people are already leaving, and it's already been a long, really interesting discussion. Thank you so much for our speakers, and thank you so much to everyone that came and listened to this webinar. I'm sorry that we couldn't take all your questions. Hopefully we will answer them in the future, and see you at the next ePOC webinar. Thank you again.
Thank you.
Thank you.
Goodbye.